hello, and welcome to Sheila Lives Out Loud. My name is Sheila Moniga. Thank you for finding me. I know, we haven't kicked off the season, so you're probably wondering, does this mean season 10 has started? No. Slow down, Speedy Gonzalez. We are about to start, but before that, I just thought to myself, it's been a minute since we talked to our good doctor, Dr. Simon from the Kenya Medics Association. He is the Secretary General of the organization, and he's been working with us during the COVID pandemic. He's walked us through what that disease is. He's walked us through the different mutations. He has been there as a source of information, knowledge, and also support, because at times, let me not cheat you, I was also shaking. I was quaking in my heels. I didn't know where we were going to go. I didn't know how we would survive, but here we are. And that's it. You know, it takes all of us to pull each other to get through the hardships. And so first things first, Dr. Simon, thank you for making the time to sit with us yet again. And the reason why we're sitting with Dr. Simon today is because it's been a minute, like I said, since December, when we touched base and discussed the Omicron variant and the fact that it was making the kind of rows that even Lewis Hamilton could not make. This thing was fast, minus slow. Everybody had a Homer, but we all know what that was, right? So what does this mean for all of us, not just around the world, specifically for Kenya? Life in the 254, in the 2022. Sasa Daktari, are you ready to break it down?
Thank you very much, Sheila. And I am sure many people have been educated by your program and continue doing what you're doing. And I'm very happy to continue doing my part. And thank you for having me.
Super. So today I'd like us to go through several things. We've got to talk about long COVID. We've got to talk about COVID in children, and we've also got to talk about vaccines. So I think first things first would be, where are we as a nation post Omicron, or are we still in Omicron? Is there a new variant people are suspecting? You as a doctor being in the medical field, are there new things that munaona, munahisi, but the rest of us don't know? Following December's ridiculous numbers in outbreak, where are we now in Kenya as of February 1st?
So I think just to go straight to the point, our biggest issue with COVID is mortality, as in death. And what we have witnessed recently is that the mortality as a result of COVID has decreased. It has not gone to zero, but it has decreased. This has been attributed to several factors. The variant of COVID that caused a lot of morbidity and mortality was the Delta variant. That seemed to have a lot of morbidity, any sickness, and mortality, that is death. But the Omicron variant seems to be having less of that. Despite it being more transmissible, it looks like its ability to cause mortality is less. And this is a good thing. Several reasons have been attributed to this. The first one is say there is an increase in the number of people who are vaccinated, so it is protective. The second one is that the natural history of viruses are such that when they mutate, they get weaker in terms of causing mortality, which is a good thing. Even the virus knows that you cannot kill all your hosts. So that is what has been shown by the latest variant. Okay. So that's where we are. Also at the point that we have more vaccines available, and actually people are now being called to vaccination centers all over, and these are also being distributed, even as you may have seen, to churches, to what we envisaged as the vaccination program should be from the beginning. I think we are making good progress on the same.
All right. Speaking of making good progress in vaccinations and the virus weakening, I've had a lot of people ask, okay, if you probably caught Omicron in December or early January and have since recovered, what is the appropriate time before going for a booster or maybe going for your second shot? Because we know the order in which people have been getting the vaccine has not been equal for all. So in the event that you contracted the virus in December or early January and are feeling all right now, what is the right medical advice towards getting a shot, whether it's your first, your second, or a booster?
So 1 month. The simple answer is 1 month. They say that if you've gotten COVID and then you want to have a vaccine, then 1 month is the time you need to wait or get a booster. I have colleagues who actually got COVID maybe sometime in December, November, and have now gone for their boosters. So that is the current recommendation.
All right, that makes a lot of sense as well. Last week, I went over to the Aga Khan University Hospital and I was able to get a booster. And it got me thinking, when I walked in, I saw 3 different lines and I was asked, so which one would you like? It was almost like going into a perfume shop where they've got Christian Dior and then they've got Chanel and they're asking you, okay, so which one do you want? Is there a method towards choosing a vaccine for you, or it doesn't matter? I know early last year we got what? It was Astra because I went with what I knew. Can you mix and match, or are there recommendations for the right vaccine for you?
So the increase in the variety of vaccines in the country is a result of the several purchasing lines that the country has gotten. Some vaccines are donated. So the people who donate the vaccine that they have. Others are purchased. And therefore, we are lucky as a country that the ministry has been able to avail different kinds of vaccines. And studies have shown that you can actually get a booster that is different from the initial vaccine that you took. And therefore, those who initially in Kenya took AstraZeneca may opt to get now one of the mRNA vaccines as a booster. So that is has really helped. So it is good that there is a variety. Actually, now the challenge we are facing is actually people are being asked to come for vaccines, and vaccines are also being distributed across in churches, in vaccination centers, and that is the scenario we had actually envisaged at the beginning of the outbreak. And that was the scenario we envisaged when there were lockdowns. When there were lockdowns, the reason for that was to make vaccines available. And when vaccines become available, then the need to do lockdowns becomes less and less, and therefore the economy keeps going. One of the reasons is because of vaccinations.
All right. And so far, so good. I cannot begin to explain to you how awesome it's been not having to rush home or be afraid on the roads when it's 5 minutes to 10 because you're afraid of not being home before curfew is up. But I'd like to look at possible side effects, especially if you're taking a vaccine that you haven't taken before. I chose Astra because it was what I knew, and I knew how my body would react to it. The first time, of course, your arm hurts, delayed periods. But what are the possible side effects for people so that when you go for a vaccination, usidhani unadedi, you're doing okay? These are perfectly normal side effects. What would those be?
So the side effect profile is, if we start from the back end of you have gotten a vaccination and you feel something, so to speak, it is people are encouraged to actually report some of the things that they feel. So majority of the people would actually say that they had a pain, of course, on injection, Others have developed swelling, maybe at injection site. And for some, it may have developed into bigger than anticipated. So people are asked to report. Others may have a feeling of tiredness or fatigue or joint pains. And we are encouraged to actually build a body of sort of the side effect profile that we are feeling. No, so far, we have not heard of any catastrophic, so to speak, side effects that can be, that has been linked directly to the vaccination. And that doesn't mean it cannot happen, but so far the information that is coming through is that generally the vaccinations have been protective, and a lot of people are not reacting too badly to them. So it is important for people who may experience side effects to report, and there is a reporting tool from the Pharmacy and Poisons Board, and a line through which someone who thinks that they have been affected or what they are feeling is as a result of the immunization, then they can report.
Okay, all right, very well said. I'd like us to now move forward to COVID in children. What are the numbers looking like? Because we know schools have opened, life is pretty much finding its way back to what we used to know in some dimensions. But talking about COVID in kids, we understand that we're not completely done yet. What does that look like for parents who've got little children? How can you best advise them to watch out for COVID in kids? Because tunajua kuna homa na shule zikifunguliwa, homa is the second thing that happens after opening of schools. How do you tell the difference between homa and huyu akona COVID? Is there any way to do that?
Actually, the only way is to do a test.
Okay.
A COVID test. But on the situation of COVID in children, as I said, why COVID was very significant in the adults is that some people, when they got COVID, died. Now, that doesn't seem to be the case with children. And that's why sort of it may be a bit more difficult to get the accurate numbers of how many children have gotten COVID. But from the pediatricians, first, a lot of the pediatricians have come down with COVID, and most likely they got it from children. We see a lot of children.
Yeah.
And there have been several cases of flu, especially in schools and all, and that may be COVID. But as I said, because the children are not dying, and they may have those sniffles, running nose, a bit of a cough, and also COVID in children may present atypically, maybe some diarrhea or something. Then COVID in children per se becomes not significant in terms of causing death, but becomes significant in terms of passing on the virus.
Yeah.
Because the adults will interact with children. And so COVID in children has been witnessed, and a lot of the pediatric facilities and pediatricians have seen many flus, and we are saying, thankfully, it is not a major cause of morbidity and mortality in children, but there has been cases of COVID in children.
Okay. Vaccinating children. Have we begun to do that as a nation? Is there a plan for it? And how will it be conducted? I know, and when I say plan, I don't mean how will they inject. I just mean what will that rollout look like?
Initially, when we were vaccinated, we were doing it for adults above 18 years. And then there was a push to try to lower the limit as the older secondary school children. It was seemed that it was important for them to get a vaccine. So currently, the lower limit is 16 years for Kenya. In the Americans, their lower limit is 12 years. And I guess the discussions in this country will continue to see what the cost-benefit analysis is, and whether in the future there'll be a vaccine for children. So as has always been the issue, no studies, so to speak, have been done in children. And before you roll out any medication, so to speak, then studies need to be done on safety and all. But because those hadn't been done, especially for children, and more so that the children were not necessarily dying from the illness, then that's how studies will continue being done to see what is the lower limit that you can give children. However, for pregnant mothers, we have recommended that they get vaccinated, because we have seen that COVID is, pregnancy is like what they were calling a risk factor for COVID. So the outcomes for COVID in pregnancy are worse if you are unvaccinated than if you're vaccinated. So we urge all pregnant women to get vaccinated.
All right. Finally, Daktari, long COVID is something that is a complete segment all on its own, and it is something we are going to discuss in detail in subsequent weeks, because again, long COVID is still something I suppose all of you in the medical field are also observing and studying and learning new things about with every passing week. So let's talk a little bit about what long COVID is and what you've experienced so far, not as your personal experience, obviously, but what the medical field in Kenya is reporting and seeing being presented.
So different people take different lengths of time to recover from COVID-19 infections. Some people, after a few days to a week, they have made a full recovery. Majority should have recovered within 12 weeks, yeah. But there is the concept of what they are now calling long COVID, whereby some people have the symptoms of COVID linger on longer than they are supposed to. This is not necessarily linked, and this is important, is not necessarily linked to how sick you are. So because even those with mild symptoms are actually reporting what are called symptoms of long COVID, so to speak. Okay. So there are many symptoms. There are many symptoms that seem to be associated with this phenomenon, so to speak, or it's a new thing that is actually continuously being studied. Like you can have some people who are saying they even long after COVID, they are feeling extremely tired, fatigue. There are those who are saying they feel shortness of breath and have chest tightness and chest pain. Then there are those who are saying they have before, and their concentration is also poor. Others are complaining of insomnia, lack of sleep. Others occasionally feel their heart is beating faster. Then there are others who are saying they may have pins and needles that are coming long after they've recovered, so to speak, from COVID. Others, their ears are ringing, you know, that thing called tinnitus. So occasionally feeling sick, diarrhea, stomach aches, loss of appetite. Once in a while, others get temperature, can have a cough, headaches, sore throat, and that famous sense of smell disappearing, and even some rashes. Yeah. So long COVID is a phenomenon which is being looked at, whereby you had COVID, recovered, but there are some symptoms that seem to linger on. So we want to see, is it as a result of COVID? And hence, the importance of even avoiding the mild COVID, so to speak, because as the disease evolves, then it is only with time that you will know what these symptoms of long COVID have. I've had one or two of my colleagues getting some of those symptoms, and they think they actually attribute it their previous COVID infections. So it is an emerging phenomenon. It's continuously being studied, but the long and short of it is symptoms that persist long after COVID-19 infection.
All right. We will be speaking more about this in the next few weeks as promised. And I'm sure by then you'll have an even more clear picture of what it is and how we're all going to deal with it. Because I think the fact is this virus has really spread. It's something now we all know, we all understand and have come into contact with. And it's best to be prepared again with the tools to deal with the repercussions of COVID. Asante sana, Daktari, for speaking with me. As always, we're still not out of the woods and we still have to exercise the right measures. Those have not changed, have they?
So we urge people to get vaccinated. Then when you are in crowded places, then you wear your mask, wash your hands with soap and water, and occasionally sanitizer, depending on where you are. And should you feel ill, then you visit a health practitioner and a COVID test once in a while when you think you have symptoms of COVID, and isolation. Now, the isolation period for people who are not very unwell has even been reduced to 5 days, you see, as opposed to the longer days.
Right. So continue exercising the right measures. Msishuku tests. I know people who are deathly scared of going for tests. It's always best to know what the truth is so that you can fix it where you can, while you can. Daktari, I wish you all the very best this week. Thank you for your company and thank you for your insights. Tukapatana huko mbele.
Kabisa. And keep doing what you're doing. We appreciate.
Thank you, Daktari. If you've seen something in this episode that's taught you something that you know you must pass on forward to somebody else, please do pay it forward. Knowledge is power. And when you've got power, you can deal with life as and when it unfolds. Thank you again for watching this episode. Click subscribe, hit notifications if you haven't already. And I'll be seeing you soon for season 10 of Sheila Lives Out Loud. Until then, live out loud in all that you do. Bye for now.